So once we have talked about this, then we shall move on to the rheumatic heart disease, right? Okay, so now let's talk about the fourth category over here, that is the rheumatic heart disease. Okay, rheumatic heart disease. Basically, rheumatic heart disease, I told you in the initial part of this section that in the non-communicable disease, we are actually classifying them as infectious or non-infectious. Rheumatic heart disease component is actually coming in the infectious category, right? So basically, in the rheumatic heart disease, we are talking about that this is the infectious etiology, and it is actually caused by, yes, you should be actually telling me, that is the group A beta hemolytic streptococci, right? So that is the etiological agent over here. We know this very well, right, from our microbiology classes, from our pathology classes, from our medicine classes, right, several places, from our pediatrics classes, and now in the PSM we are reading this, right? Okay, so guys, basically this is the infectious disease. I told you earlier that it is the infectious disease, okay, and in this particular case we are talking about that what age group we are actually telling in the rheumatic heart disease. So what kind of age group we are actually talking about in the rheumatic heart disease? That is, it is usually affects the adolescent and the children. So basically 5 to 15 years, right? So basically the pediatric age group, right? And next point over here is that this is the disease which is actually involving the valves of the heart, right? So it usually affects which particular valve, guys? It usually affects the mitral valve, and we know that the complication of this is mitral valve, and basically it might cause the mitral stenosis, then it might cause the mitral regurgitation as well, right? However, you might be seeing that multiple valves can be involved as well, but this is the most common one. If we talk about the heart disease incidence, right? So this is the most common cause of heart disease in the adolescent and the children age group. Okay, so or even having the basically if you talk about the older children, or I will talk about 20 to 30 years also. So basically from the 5 years till the 30 years age group. Okay, most common cause of heart disease is this rheumatic heart disease. So most common cause of heart disease in 5 to 30 years age group. Okay, that is also a very important point. And if you talk about the prevalence over here, 5 to 7 per 1000 population is the rheumatic heart disease people. So prevalence, if you talk about in the community, that is also very high, that 5 to 7 per 1000 population, that is the prevalence of this rheumatic heart disease. So very important disease, right? And usually it is affecting those areas which are actually poverty hidden areas, or the low socioeconomic areas, right, or the areas where very much overcrowding is there. So that kind of areas is actually hidden by this rheumatic heart disease. So rheumatic heart disease is actually affecting, right, low socioeconomic areas or status people, overcrowding places, right, right, and poverty hidden areas. So these are the areas where the rheumatic heart disease might be coming in this particular lesions, right? What is the drug of choice if we talk about in this particular rheumatic heart disease? So drug of choice in this case for the prevention or the prophylaxis purpose, that is the benzathine, yes, benzathine benzyl penicillin, yes, so benzathine benzyl penicillin over here, right? That is the drug of choice for the prevention or the prophylaxis purpose as far as rheumatic heart disease is concerned, right? And from the government of India side, they have launched one scheme, that was the Jai Vigyan mission. So Jai Vigyan mission was launched from the government side. These are the salient features from the community point of view, guys, as far as rheumatic heart disease is concerned. So Jai Vigyan mission was launched, right, for the rheumatic heart disease, or I would say rheumatic fever, by the government of India, right? So that might be asked. So what mission was actually launched for the rheumatic heart disease or rheumatic fever? That was a Jai Vigyan mission, right? Okay guys, once we have talked about this, right? Now we shall move on to one more important disease over here, that is the cancer, that is in the non-communicable disease. And as you will be taking this name in front of any of your patient, then obviously they will be having that fear inside their heart that what you are talking about. So that is the disease, that is the cancer, right? Okay, so if we talk about the cancer, right, that will be our fifth point of discussion, that is the cancer. In the cancer, basically we are talking about that this is the most sensitive matter which you are actually talking about in your patient. You know, when we are actually counseling our patient about the cancer, okay, first of all, in itself we should be very sure about this particular thing, and we are actually having important screening modalities in front of us, and then once we are getting the confirmation from them, right, then only we are actually talking about this particular disease to our patient, that is the cancer, right? Because it's not like that if you are talking about cancer in your patient, right, and in the next moment you are finding out no, it was not cancer, it is just something else. So it's kind of a, you know, great kind of confusion among the patient and the doctor, right? So we don't want that, obviously. So for the cancer purpose, we are having most sensitive screening modalities, right? And different cancers are having different kind of modalities. For example, so let me talk about the important sensitive screening modalities. So most sensitive screening modalities for different regions, right? For an example, if I'm talking about, you know, let's say first one, if I'm talking about breast cancer, let's say, for the breast cancer we are having what? Mammography. And it is usually advised above 40 years of females, they should be actually going for the mammography on annual basis, so that we are finding out breast cancer in the early phase itself, right? Otherwise, most of the females are coming up with the breast cancer to the breast surgeon basically in the third stage, right? And that is obviously having not very good prognosis. Okay, second one, if you talk about, for example, the person might be having the cancer of cervical regions, that is a cervical cancer, not this cervical I'm talking about other cervical region, that is the cervix in the females, right? So cervical cancer, yes, very popularly, you know that is the, yes, I know that you are talking about the pap smear, guys. But over here, one trick is there. What is that trick? Trick is, if I'm talking at the rural level, if I'm talking about that at PHC level, if I'm talking about that at PHC level, you know, the answer changes. There might be the two things. One is the PHC level, that is a primary healthcare center, and one is the CHC level, that is a community healthcare center, right? If you talk about, you know, first of all, we are having, you know, at the basic level, we are having in the community, if we talk about, there is a village. Above the village is taken care under the ASHA. Okay, we'll talk about that in the separate chapter. There is a village. Above the village, we are having a sub-centers. Above the sub-centers, we are having a primary healthcare center. Above the primary healthcare center, we are having a community healthcare center, right? Above the community healthcare center, we are having the district hospitals. So basically, if I'm talking about primary healthcare center and the community healthcare center for the cervical cancer, screening modalities are different, guys. At the PHC level, if I'm talking about, I will be saying that visual inspection method. Okay, please remember that visual inspection method, right? Visual inspection method with acetic acid. Okay, with acetic acid, that would be the screening modality of cervical cancer at the level of PHC. If I'm talking about at the level of CHC, then definitely your answer is right. If you are saying that is pap smear, right, then definitely I will agree that this should be the pap smear. Okay, this should be the pap smear. So please remember this, very important MCQ, and they might confuse you at this level, because usually we are reading that pap smear, right? You are working in the community hospital, you are working in the corporate hospital for an example. What will be your answer? I know that would be the pap smear, yeah? And at that point of time you will be correct also, because you are not working in the PHC level at that point of time. But if the question is basically particularly mentioning that at the PHC level they are asking, then your answer will be the visual inspection method. Okay, I hope I made the point clear. Next point over here is, if you are talking about cancer, you know, you might talk about on two levels. One is the global level and one is the India level. So according to this, the answer might be changing, right? And it might be confusing for some of you, but I will try to reduce it further. So guys, over here the main point over here is that if you talk about this particular cancer, right, and if you talk about globally, right, so let me just write over here. Globally, what is the most common cancer? That might be the question. Most common cancer. Next question could be most common cause of death due to cancer. Most common cause of death due to cancer. Two questions might be there. Now, most common cancer, if they are asking you on the global level, then we are seeing actually the lung cancer, right, then the breast cancer, right, and the colorectal cancer, then the prostate cancer and the stomach cancer. Okay, but I think this list will be enough. Most common cause of death, if they are asking you, then lung cancer, colorectal cancer, stomach cancer, and so on. Lung cancer, colorectal cancer, stomach cancer, right? The list will be going like that in that case, right? So we have talked about earlier that, you know, globally, if you talk about most common cancer, if they are asking you, then it will be the lung cancer most commonly, then it will be the breast cancer and the colorectal cancer, right? But if we talk about most common cause of death due to the cancer, basically, then it will be the lung cancer, colorectal cancer, and the stomach cancer, right? That will be enough. But you know, in India, if we talk about, according to the basically the cancer unit, okay, basically they are talking about according to National Cancer Registry Program, right, that is your NCRP, right, in NCRP India in 2020 this was launched basically, and they are telling that most common cancer in the males and females, right? So most common cancer in the males, if they are asking in India, and most probably the question will be asking you from this category only. So most common cancer in males and females, right? Then if they are asking you in India, basically most common cancer in males, then it will be lungs, then it will be oral cancer, then it will be the stomach cancer, right? Then it will be the esophagus cancer, but that is enough. And if you talk about in the females, basically if they are asking you, then it is the breast cancer, then it could be the uterus cancer, uterus CA, right? So that will be the list over here. Now one more thing, you know, we know that basically the cancer, basically we are actually representing it with the ribbons, basically, you know, lavender if we talk about cancer awareness ribbon colors over here, and you need to know that lavender color is actually telling about all cancers, right? Lavender color is telling us about all the cancer. Otherwise many other cancers colors are present over there, but that can be the lavender color is telling us about the all cancers, right? Next thing over here, you know, national health programs that are related to the non-communicable diseases. If we talk about national health programs, then first one which I want to highlight over here, that would be the first one which I want to highlight over here, that would be the NPCDCS. What is NPCDCS? That is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular disease, and the stroke. Yes, that is a long name actually, but that's how it is. So here this is the logo which you should actually remember, because that might be asked. So this is the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular disease, and the stroke. That is for the prevention of the non-communicable disease. That is one of the health program, okay. And basically in this category, you know, we might talk about from the WHO side, they are actually talking about the non-communicable disease targets for 2025. And what are these 9 targets over here? They are talking about the 9 targets. How many targets, guys? 9 targets. And these are the 9 targets over here, okay. They might be achieved from 2010 to 2025, or so obviously this is running right now. So over here we are talking about the premature mortality from the non-communicable disease. We want to reduce it by 25%. We want, you know, along with that, you know, there could be the non-communicable disease medication and technology. We want to cover it. 80% coverage might be given over there. There could be 50% coverage by the drug therapy and the counseling. There could be 0% increase in the diabetes and the obesity incidences. We want to reduce it drastically, okay. And we want to reduce the BP incidences in the community for about 25%. We want to reduce the 30% uses of tobacco. We want to reduce the salt and the sodium intake 30%. We want to increase the physical activity in the community. So physical inactivity would be, we'll try to decrease it by 10%, right? And we want to decrease the harmful use of alcohol in the community, right? So basically the question might be coming in your exam that which of the following is not the target in the WHO category for the prevention of non-communicable disease. So these are the 9 targets which you need to know as far as WHO category is concerned, right guys? And here there are actually some silent features of the non-communicable diseases program, okay, which was the NPCDCS, and the features over here is like screening of the age more than 30 years for the diabetic and the hypertension patients, so that we are actually trying to diagnose it early and treat it early. Second thing is screening should be done in both hospital and the community level, right? This community based screening, that might be done by the health worker at the sub center for both male and female. And hospital based screening, if you are talking about, then there should be staff which was appointed at DH and the CHC, right? Okay, district hospital and the community healthcare center. Strengthening of the district ICU should be there. Opportunistic screening of the common cancers like cervical cancer, breast cancer, oral cancer, as they are very common among the as they are common among the males and females over there. And curative services should be made available in the PHCs. Basically, health promotion and counseling should be done at the PHC level and the CHC level and the district hospitals, right? So these are some of the targets, these are some of the salient features for the non-communicable disease program, that was NPCDCS, right? Okay guys, now we shall talk about one more very important thing over here, that is for the burns, right? So over here in the non-communicable disease prevention, there is one more program they have actually introduced, and that was the National Program for Prevention and Management of Trauma and Burn Injuries, right? Trauma and burn injuries, right? In short, they are telling about the NP, PMT and BI for the burn injuries, right? Here they are talking about 3 important factors. Not a 3 important factors, basically they want to tell that there should be the burn units properly allocated nearby the trauma center, so that the specialized burn treatment should be given to those patients who actually need the specific burns unit. So there should be the allocation of burns unit, okay, near the trauma center, right? Near the trauma center, isn't it? Okay, then one thing is that there should be burns unit presence in all district hospitals. So burns unit should be there, burns unit should be present in all district hospitals, okay? That is a target of this program, all district hospitals, so that specific burns treatment would be given to these kind of patients, right? And the next thing over here is, in every corporate hospital, if it is more than 100 beds hospital, then 6 beds should be reserved among the 100 beds hospital. They should be reserved for burns patient, okay? So these are 3 salient features, burns patient, right? So they are salient features of the burns unit over here, right? So in this particular session guys, we have talked about the non-communicable disease, we have talked about the measures which can be used for the prevention purpose of this disease, and the main ones which we have targeted in this particular session, that was the coronary artery disease events, okay, cardiovascular events, and the obesity and the hypertension. We have talked about the rheumatic heart disease, which was the infectious non-communicable disease, and we have talked about some programs over here, as far as we have talked about the cancer also, and we have talked about some programs which are actually related to the non-communicable disease. So thank you so much for listening this section, and I will be seeing you in the next one. Thank you.